Good evening. Everyone who knows me knows that I don't do nighttime videos, but this is very remarkable. My name is Alex Ehsan. I'm a hematologist oncologist, and I want to tell you about Michael. He's a 52-year-old gentleman that I had the pleasure of meeting about 3 years ago. And when I met Michael, he basically came to me for having had a very large tumor that uh, was causing him significant amount of pain and pressure. And thanks to his wife, he agreed to go in and just have a simple CBC and a CMP, which is the least amount of blood test anybody can do. And when his blood work came back, his white blood cells were extremely high, and he was told by his primary care doctor that he was certain that this was leukemia. And Michael, being Michael, he kind of looked at his primary care doctor and said, "Well, it is what it is, and I am willing to do what I need to do to take care of my family." So we worked him in, and he came in. He allowed me to do a bone marrow biopsy, which I've talked about many times before. So everybody should now know. We give you some lidocaine, and then we use a needle, and we get a sample of the soft part of your bone. And luckily, when his blood work came back from his bone marrow, he had chromosome 9 and 22 mixed up, and that's called 922 translocation. And for some reason, we call that Philadelphia chromosome. And it causes a gene called BCR-ABL mutation. And once you have this BCR-ABL mutation, you continue to just grow and develop these abnormal white blood cells. Luckily for him, we have pills called tyrosine kinase inhibitors, one of which is called Gleevec or imatinib. And we were blessed enough to get him started on one of these pills. To be very scientific, imatinib, dasatinib, nilotinib, bosatinib, there's enough of them. I call them the band, BAND, because there's a pill for every letter. And it's not always the best pill for everyone, but it ended up being the best pill for him. He started taking it. He really truly did not suffer much side effects, and his white blood cells started going down. And within a few months, we checked his PCR to look for chronic myeloid leukemia, and it was very reassuring. His numbers were decreasing day by day, and the medicine was working properly. And it was mind boggling that his unexplained fatigue disappeared, his weight loss stopped, his night sweat stopped, he was no longer bruising, his abdominal fullness and inability to eat the lovely food his wife was making him went away. And so it was it was quite nice to see him back to normal. So the reason this excites me is that we have chronic myeloid leukemia, a cancer that I could only do a bone marrow transplant for 20 years ago, and it almost never really worked. Now can be managed with a pill. Uh, some patients have muscle cramps and diarrhea. Some complain of shortness of breath, and luckily, that wasn't what Michael struggled with. Luckily, and his numbers went down. And today, many people with chronic phase uh, leukemia of the CML type do have the Philadelphia chromosome, and they can travel to Philadelphia. They can see their kids grow, and they can celebrate anniversaries, and they can be just normal. And eventually, we are aiming for what I call treatment free remission, meaning you don't have to see me. So I thought this is a very uplifting story of treating leukemia simply with a pill. And his daughter, who's a nurse, told me, Dr. Ehsan, his PCR polymerase chain reaction looks really good. And I said, yes, you need to become an oncology nurse. So, to make the long story short, chronic myelogenous leukemia is a cancer that you can diagnose by testing for BCR-ABL, which is basically a PCR test. Uh, we have 5 pills available. We usually start with the first one, and hopefully that works. If not, we give you the next one. And luckily, in CML, the science is so beautiful and so exciting that everyone who ends up getting one of these medicines practically goes into remission. And if they don't, they end up with a bone marrow transplant. But I thought this was a very uplifting story of having leukemia that would have killed him 20 years ago, and now with a pill, he's in complete remission. So if you've been recently told that you have leukemia and there's no hope, don't listen to them. There's plenty of hope. And if you're my patient with chronic myelogenous leukemia, I look forward to seeing you next month. We'll check your BCR ABL numbers, make sure they're good. And if you're not my patient and you don't have BCR ABL, or I just hope you never have it. So I definitely don't need for you to have cancer to come and see me. So I hope this 7-minute video has helped somebody, and I wish you the best of luck. And there's going to be a complete description in writing on my YouTube video, and hopefully I'll see you in the future for non-cancer related topics. Have a blessed evening.